Welcome. Let's look at the perineum. Using this image by the side here, this is where we have the abdominal cavity up here. And we know that inferior to the abdominal cavity, we have the pelvic cavity. The inferior limit of the pelvic cavity is formed by the pelvic floor. And this is what is carried here in black. Inferior to the pelvic floor is where we then have the perineum. And this is the perineum here carried in green. So the perineum is the most inferior limit of the trunk. And this is what is carried here in green. In this lecture, we'll be focusing on the configuration of the perineum and also the structures that are located in this region. The perineum is a diamond-shaped region that is located below the pelvic diaphragm. Using this image down here, this is where we say we have the pelvic cavity. And we say that at the inferior limit of the pelvic cavity is where we have the pelvic floor or the pelvic diaphragm. I have put up a lecture on the pelvic floor. If you've not checked that lecture out, please kindly go and do so. In that lecture, we described that the pelvic floor is a collection of muscles that are seen to form the inferior limit of the pelvic cavity. And this is what is seen to be arrowed here in blue. So if you go more inferiorly to the pelvic floor or the pelvic diaphragm, is where you have this diamond-shaped region that is referred to as the perineum. And this is what is highlighted here in this image. So this is where we have the perineum at the most inferior limit of the trunk. So what is it about the perineum? The perineum is a very important region of the body, and that is why it is good that students of anatomy will study this region. The perineum creates a final exit for the gastrointestinal tract. If you look at this image here, this is where we say we have the perineum. And it is around the perineum region that we have the opening of the anal canal. We know that the anal canal is the inferior continuation of the rectum, and these two structures are components of the gastrointestinal tract. These are the digestive tract organs. And the anal canal, which is the terminal region of the digestive tract, is seen to finally open into the perineum because the undigested food substances need to be released out of the body, and it is through the anal opening that this release is done. And of course, it is in the perineum that we have this anal opening. It is also seen to create a final exit for the urinary system. We know that the urinary system, at the most terminal region, we have the urethra. It is the urethra that will finally carry the urine that is produced in the kidney and also temporarily store the urinary bladder out of the body. So it is through this urethra that urine is finally released out of the body. We also have the opening of the urethra also in the perineum. And this is what is seen to be highlighted here in blue. Then finally, we have the final exit of the genital system. So we have the penis around this region, and we know that along the penis, we have the urethra, which carries urine and also semen in the male. And the semen also is needed to be released out of the body through the urethra. This runs along the penis. So the penis is also seen to find its space within the perineum. So we also have the scrotum also taking its space around this region. Then also we have the opening of the vagina. The vaginal canal is seen to be highlighted here at this point. The vaginal canal also needs to communicate to the external environment because this is where the penis is inserted into during copulation. So you see that a number of systems within the body find their exit points around the perineum. So you see how important the perineum is. And this area is seen to be highly sensitive. It is a highly sensitive region because of the densely packed nerve endings that are located around the space. The number of organs that we have highlighted in the perineum are seen to be inserted with bundles of nerve endings. And this is what makes this area to be highly sensitive. And if you compare the contents or structures that are located within the perineum between the male and the female, you see that they are different. And this is attributed to the peculiarity of the reproductive system. The male reproductive system and the female reproductive system are not the same. So they have features that distinguish them. And this is why you have different structures in the perineum, in the male and also in the female. So let's drive further looking at the boundaries of the perineum. The boundaries of the perineum is classified into two. We have the deep boundaries. This deep boundary is also referred to as the bony boundary. This is the bony landmark of the perineum, and we will be unfolding this as we go through with this lecture. The second basis onto which these boundaries are created is the superficial boundary, and this boundary is also referred to as the surface boundary. We would also be going into this as we go through with this lecture. So let's try and drive in through the deep boundaries first. This is also referred to as the bony boundary. This is the bony landmark of the perineum. And this is the same as the bony outline of the pelvic outlet. If you look at this inferior image here, this is where we have the pelvic outlet. This is an inferior view of the pelvic cavity. So if you look at it from the inferior side, this is the configuration that would be seen. And this is the configuration of the pelvic outlet also, because we say that the pelvic outlet is the inferior limit of the pelvic cavity. It is also guided by the pelvic floor or the pelvic diaphragm. This is a collection of muscles that are seen to pad up the pelvic outlet. And this is where these muscles help to reinforce or support the pelvic viscera by helping to hold them in place. So this is where we have the pelvic outlet, and the alignment of the pelvic outlet is also seen to form the bony boundary of the perineum. If you go back to where we started this lecture, we said that the perineum is the region that is seen inferior to the pelvic floor or the pelvic diaphragm. This pelvic floor or the pelvic diaphragm is seen to fill up the pelvic outlet. So we can say that the configuration of the pelvic outlet, which is also diamond-shaped configuration, is the same as the configuration of the perineum, because immediately after the pelvic outlet, the next structure that you see is the perineum. So the perineum is also taking the same configuration as the pelvic outlet. So let's try and drive into this outline to see the different specific regions that are seen to form the alignment of the perineum. So let's use this image by the side here for illustration. This is where we say we have the inferior view of the pelvic cavity. At this region that is exposed here is the pelvic outlet, and we say that the pelvic outlet is guided or closed up by the pelvic diaphragm. This pelvic diaphragm is a collection of muscles, because we do not expect that the pelvic outlet will be opened, because we know that within the pelvic cavity, we have a number of viscera or organs that are located within this space. And if this space is not guided, it means these organs may be displaced. So this is where we have the padding up of the pelvic outlet by the pelvic diaphragm. And inferior to the pelvic diaphragm is where we then have the space that is referred to as the perineum. This is where we have the anterior view at the front, and behind here is where we have the posterior view. So let's drive in through to see the different structures that will be forming the outline of the perineum. Remember also at the back of your mind that we say this region is a diamond-shaped outline, and we know the configuration of a diamond-shaped pattern. So in the mid anterior region, it is formed by the pubic symphysis. And this is where we have the pubic symphysis here in the anterior part. We say that the pubic symphysis is a joint that is formed in the anterior part of the pelvic cavity, where we have the body of the pubic on the right side and also the body of the pubic on the left side uniting at this space to form the pubic symphysis. We also have the arcuate ligament here, also highlighted here in yellow. This arcuate ligament is an inferior pubic ligament that is seen to reinforce the pubic symphysis at this region. We say that the joints in the pelvic cavity are reinforced by ligament, and this is one of the joints here that is seen to be reinforced by the arcuate ligament. So this arcuate ligament is also referred to as the inferior pubic ligament that is seen to reinforce the pubic symphysis in the inferior region. So at this inferior region, you have the arcuate ligament. So if you talk about the bony alignment or configuration of the perineum in the mid-anterior region, you have the pubic symphysis and also the underlying arcuate ligament. And because we say it's diamond-shaped, the anterolateral outline is formed by the pubic arch. This is what is saying to be highlighted here in red. And this pubic arch is also referred to as the ischiopubic ramus. If you go more to the lateral edge, at this point, we have the ischial tuberosity. And this is where we have the ischial tuberosity here, arrowed in green. If you go more to the posterior region, at the lateral posterior region, we have the sacrotuberous ligament. And this is a sacrotuberous ligament here, arrowed in black. While at the posterior midline region, this edge is formed by the tip of the coccyx. And this is what is seen to be perineum at this point. This alignment that is formed on this part is also formed on the other side, so as to complete the alignment of a diamond-shaped outline. So if you go more on this side, you also have the sacrotuberous ligament, also perineum in black. And if you go to the lateral edge here, you have the ischial tuberosity. If you go more to the anterolateral region here, you have the alignment that is formed by the pubic arch or the ischiopubic ramus. Then if you go more in the anterior midline, we already said this, you then have the pubic symphysis that is underlined by the arcuate ligament. So you can see this complete orientation here forming the outline of the perineum, but this is the bony boundary of the perineum or the deep boundary. If you try to use this image down here, this is a diamond-shaped configuration. And if you go to the anterior midline region, we say we have the pubic symphysis and the underlying arcuate ligaments. If you go more lateral at the anterior region, you have the alignment here created by the pubic arch or the ischiopubic ramus. Then if you go to the lateral edge, because we say it's a diamond-shaped configuration, and this pattern will present a lateral edge at this point, and this region is formed by the ischial tuberosity, and this is what is seen to be perineum in green. If you go more posteriorly, at the posterior lateral region, we have the sacrotuberous ligament, and this is what is highlighted here in black. Then if you go further to the posterior midline region, also because of its diamond-shaped configuration, you have the tip of the coccyx forming the boundary at this point. Then this alignment is also formed on the other side. So on this other region, we also have the sacrotuberous ligament here, also highlighted in black. Then at this lateral edge, you have the ischial tuberosity. Then if you go more anteriorly, at this anterior lateral region, you have the pubic arch. You can see this alignment is seen to be running from one region to the other, formed by different structures from one region to the other. And at the end, you see it forming a diamond-shaped configuration. This is the bony landmark of the perineum. And this is what creates the formation of that space that is located inferior to the pelvic floor or the pelvic diaphragm. So now let's go to the surface boundary. When we try to classify the boundaries of the perineum, we say we have deep or bony boundary, and we also have the superficial of the surface boundary. We've tried to highlight the bony boundaries in our previous slide. So in this slide, we'll be looking at the surface boundary or the superficial boundaries. So the superficial boundary anteriorly, it is bounded by the scrotum in male and also the mons pubis in female. We try to use this image up here for illustration. This is the perineal region of the male above, and inferiorly we have the perineal region of the female below. So above here, if you look at the anterior region, so in the anterior region, the structure that you see to be bounding the surface marking or surface boundary of the perineum is the scrotum. Of course, on top of the scrotum, you then have the penis. While in female, the structure that you see in the anterior part bounding the perineum is the mons pubis. This is where we have the mons pubis here at this point. So if you go more posteriorly, the structure that you see is the buttocus. So behind here, you have the buttocus in male. Also in female, behind you have the buttocus. On the lateral side, you have the upper region of the right and the left thigh. If you look at this upper image here, where we have the male perineum, on this lateral side, we have the upper region of the thigh on the right side, and we have the upper region of the thigh on the left side, forming the lateral boundary of the perineum. And this is the surface boundary or the superficial boundaries. And this is what creates the alignment of the perineum at the superficial region. If you go to this lower image, we say this is the perineal region in female. At the lateral side, you also have the upper part or upper region of the thigh bounding the perineum also on the lateral side. We should also know that there are peculiarities in both the male and the female in terms of the structure that are related to the anterior boundary. If you look at the upper image, you can see that anteriorly it is bounded by the scrotum, while anteriorly in female it is bounded by the mons pubis. This is as a result of the peculiarity that is created by the reproductive system in both the male and also the female. So let's go through the limits. Let's see the structures that are seen to form the limit superiorly and also inferiorly of this space. We already know that this space is created below the pelvic floor or the pelvic diaphragm. The roof, it is bounded by the pelvic floor or the pelvic diaphragm, and this is what is highlighted here in purple. We say that inferior to this floor is where we have the perineum, which means that the roof of the perineum will be formed or limited superiorly by the pelvic floor or the pelvic diaphragm. And this is what is said to also be arrowed here in red. While inferiorly, the structure that we see is the skin, the subcutaneous fatty layer, and also the cos fascia. These are the structures that will be seen to form the floor or the most inferior limit of the perineum, because the perineum also is seen to be guided at the most external part by this structure. But let's dive in to see how these structures are seen to form this alignment. If you go back to the skin and also the superficial layer around the abdominal region and also the pelvic region, you see that there are distinct presentation around this structure. If you look at this structure by the side, you say we have the skin. The skin is the most external structure, and this is what is said to be arrowed here in black. After the skin, deep to the skin, we have the superficial fascia deep to the skin. The superficial fascia around the abdominal region is further subdivided into two. We have the outer fatty layer, which is referred to as the carpus fascia, and this is what is said to be carried here in hash. And we have an inner membranous layer, which is referred to as the carpus fascia. And this is what is said to be carried here at this point. If you look at the superficial fascia that is seen to be located deep to the skin, it is subdivided into two. We have an outer fatty layer and we have an inner membranous layer. The outer fatty layer is referred to as the carpus fascia, while the inner membranous layer that is made up of fibrous membrane is the carpus fascia. This orientation is also seen to further extend to the perineal region. But as it extends, there are distinct features that these layers also exhibit as they run through that course. So looking at the skin as the region that is highlighted here in black, the skin around the abdominal region and also the pelvic region, of course, becomes continuous as the external layer. But if you go deep to the superficial layer, let's try and take the outer fatty layer first, which is the carpus fascia. If you look at this outer fatty layer, this is what is highlighted here in dotted blue. You see it from the abdominal region extending down. When it gets to the pelvic region, it presents some distinct features. Around the pelvic region, it is also deposited, but not in the entire pelvic region. If you look at the gluteal region here behind, you see the deposit of this outer fatty layer, which is also referred to as the carpus fascia. If you look at it, you see it being deposited, but as it gets around the scrotal region, this outer fatty layer becomes replaced by the dartos muscle. You see it closely glued to the skin around the scrotal region. And this is what is said to be harrowed here in this region. So we have the dartos muscle here. These dartos muscle are thin strands of fibers that are seen beneath the skin. And at this region, they are seen to be replacing the fatty layer. So the fatty layer is seen to be limited to this region and of course become continuous or replaced by fibers of the dartos muscle. So you have the dartos muscle here in place of this fatty layer around the scrotal region, while you have it being deposited around the other region of the perineum. So if you also go more deep to the inner membranous layer that is highlighted here in green, this is what we call the membranous layer. And it, of course, is located deep to the carpus fascia, which is fatty in terms of structural components. So if you go to this carpus layer here, from the abdominal region, you see it extending down. And when it gets to the perineal region, it becomes transformed into the cos fascia. So it's good for us to know that around the perineal region, this inner membranous layer, which of course is a sub-region of the superficial fascia, around the abdominal region is referred to as the carpus fascia. But when it gets to the pelvic region, it is referred to as the cos fascia. And this is what is said to be carried here at this point. And this is what is saying around this alignment. So in the perineal region, it's given different names. So this is where we have the cos fascia here at this point. Of course, as a replacement of the carpus fascia in the abdominal region. Also within the scrotal region, this cos fascia is specifically referred to as the dartos fascia. This is what is seen to be highlighted in yellow. The cos fascia also extending to the scrotal region, but this region it is referred to as dartos fascia. So if we now drive into the floor of the perineum, the floor of the perineum will be formed by the skin, and this is what is harrowed here in black, which is the most external structure. And deep to the skin, we have the subcutaneous fatty layer. We then have the Cole's fascia, and this is what is seen to be harrowed here at this point. So you see that these three structures around this region form the inferior limit or the floor of the perineum. Where at the roof here, it is formed by the pelvic floor or the pelvic diaphragm. So the entire space around this region is the perineum. So it's good for us to be able to establish where the superior limit ends and also where the inferior limit ends. Let's look at the subdivisions of the perineum. The perineum is seen to subdivide into two. So we have a diamond-shaped perineum that will be subdivided into two. For this diamond-shaped configuration to be exposed, the lower limb needs to be abducted. When it is abducted, it means it is wide open. Then the diamond-shaped configuration can be placed. So if you look at this image down here, this is where we have the anterior view, and behind there is where we have the posterior view. The configuration of this perineum is aligned as seen in this image. So you have this diamond-shaped configuration, and of course, we've tried to establish or highlight the structures that are seen to form this alignment in our previous slide. So if you draw an imaginary line connecting the right ischial tuberosity to the left ischial tuberosity, we have the diamond-shaped configuration further subdivided into two triangles. So along this region that is marked here in dotted pink, you see that we have this imaginary line running from the ischial tuberosity on the right to the ischial tuberosity on the left. Remember, we said that the ischial tuberosity is what is seen to form the lateral edge of the alignment of the bony alignment of the perineum. When we try to describe the bony boundary of the perineum, we say that this ischial tuberosity is seen to form the lateral angle. So if we try to draw an imaginary line from one angle on the right to one angle on the left, you have the diamond-shaped perineum subdivided into two triangles. So we have the urogenital triangle in the anterior side, and this is what is harrowed here at this point. And behind, we have the anal triangle posteriorly, and this is what is seen to be harrowed here in purple. So you can see that this diamond-shaped configuration is further subdivided into two triangles, and each of the individual triangles are seen to contain different structures. For the urogenital triangle that is located at the front, it is seen to contain the urinary structures and also the external genitalia. And we say that at the front here in the anterior part is where we have the urogenital triangle. From the name, if you try to break it down, uro means urinary and genital means the genital structure. So at the urogenital triangle, we have structures of the urinary system and also the genital system. So you have the urethra here, highlighted in red, and behind the urethra, we know we have the vaginal canal in female that is also highlighted here in red. In male, we have the penis. So these are the structures that you see within the urogenital triangle, which of course is the anterior subdivision of the perineum. If you try to use this image up here, this is where we have the alignment here that is seen to divide the perineum into the anterior urogenital triangle and the posterior anal triangle. So in the anterior part here in female, if you look at this structure, you see that you have the urethra here. This is the opening of the urethra, and behind you have the vagina. These two structures are contained within the vestibule, and this vestibule is guided by the labia minora. This is the lip here, the inner lip that is referred to as the labia minora. This is what is saying to guide the vestibule on the lateral side. Then if you go more laterally on the outside, you have the labia majora. This labia majora is seen as a thick mass outside the labia minora. If you go more anteriorly, you see the labia majora uniting to form the mons pubis. So if you look at this structure, these are the structures of the external genitalia that you have within the urogenital triangle. Then if you go for the male, in the male, you also have the male external genitalia around this region. In the testes, you go more posteriorly, using this image down here, you have the opening of the anal canal, you have the external anal sphincter, of course, that is seen to guide the anal canal. This is like a sphincter that helps to control anal canal. And on both lateral side of the anal canal, you have the ischioanal fossa. This ischioanal fossa is a space that is seen to contain fatty tissue. And this helps to support the anal canal. During expansion, it helps to guide and also support this process. You also have the pudendal nerve also within the anal canal. The pudendal nerve is seen to pass through the pudendal canal. The pudendal canal is located on the lateral side of the ischioanal fossa. So these structures are seen to be contained within the anal triangle. So try to use this image up here. This is where we have the opening of the anal canal, and this is what is highlighted here in purple. So you see that the anal canal and also the surrounding external anal sphincter is seen to be located within the anal triangle. We also have a space on both sides of the anal canal that is referred to as the ischioanal fossa. This fossa, we say that it is filled with fatty tissue that gives structural support to the anal canal. Then we have the pudendal nerve also contained within this space. So these are the different structures that we see within the urogenital triangle at the front and also the anal triangle behind. Thanks for spending your time watching